In the previous class, I taught you regarding COVID-19 vaccines such as Covishield, Covaxin, Sputnik V, Moderna, and Pfizer. Today, I am going to teach you about the another most relevant vaccine named Johnson and Johnson vaccine. The another name for Johnson and Johnson vaccine is Janssen AD26.CoV2.S. And this vaccine is manufactured by Janssen Pharmaceuticals companies of Johnson and Johnson. As I already mentioned in the previous class, whenever we learned about a vaccine, we have to remember under 5 headings, that is type, dose, route, storage, and efficacy. Here, the type of vaccine is viral vector vaccine. In the previous class, I mentioned regarding what are the types of vaccine and all. There are 4 types: virus vaccine, viral vector vaccine, nucleic acid vaccine, protein-based vaccine. Here, the type of vaccine is viral vector vaccine. The vector we are using here is adenovirus 26. That thing you have to remember, adenovirus 26. And in the name itself, we can see Janssen AD26. AD26 is adenovirus 26. So here the type of vaccine is viral vector vaccine. Another important thing with regards to this vaccine is the dose of administration, that is 0.5 ml, and single dose is needed. Only single dose is needed. This is the differentiating feature of this vaccine from other COVID-19 vaccines. Only single dose is needed, and the route of administration is similar to other COVID-19 vaccines, that is intramuscular to deltoid, and storage temperature is 2 to 8 degrees Celsius. So the type of vaccine is viral vector vaccine. Adenovirus 26 is used as vector, and the dose of administration is 0.5 ml. Single dose is needed. The route is IM. Storage temperature is 2 to 8 degrees Celsius. Then now we want to know what is the efficacy of this vaccine. According to WHO, they said that after 28 days of inoculation, that is after 28 days after giving vaccination, we will get about efficacy about 85.4% against severe disease and 93.1% against hospitalization. Moreover, 66.9% against symptomatic moderate infection. So after first dose of vaccine, there is only one dose, that is after first dose, that is after single dose of vaccine, we will get about great efficacy of about 85.4% against severe disease, 93.1% against hospitalization, 66.9% against symptomatic moderate infection. Another question that will come to our mind is, does this vaccine work against new variants? As we all know that the whole world is nowadays, we can see that new variants are emerging, or mutated variants are emerging in this whole world, especially in India. For the cause of second wave of this pandemic is due to what variant? Delta variant. Okay, so this vaccine is efficacious against a variety of SARS-CoV-2 virus variants, including B.1.617.2. That is the Delta variant that is more prevalent in India. And this variant was first detected in India. That is B.1.617.2. And this is also effective against B.1.351, that variant was first detected in South Africa, and also effective against B.1.1.28.2, which was first detected in Brazil. For Indian scenario, this vaccine is more important, more advantages is there for Indian people. That is, this vaccine is effective against the more prevalent variant in our country, that is Delta variant, that is B.1.617.2. And what are the adverse events of this Johnson & Johnson vaccine? The common adverse events are all similar to other COVID-19 vaccines, that is pain, redness, swelling at the injection site, then tiredness, headache, muscle pain, chills, fever, nausea. And there are some rare adverse events such as anaphylaxis, and some other adverse event is thrombosis with thrombocytopenia syndrome, TTS. Okay, thrombosis with thrombocytopenia syndrome. These are all the adverse events of this Johnson & Johnson vaccine. Then, with regards to emergency use authorization, these are the things nowadays we can see in the newspaper and all. And this vaccine has been granted as an emergency use authorization by the US FDA. FDA is Food and Drug Administration on 27th February 2021. Okay, on 27th February 2021, this vaccine has been granted as an emergency use authorization by US FDA. And on 7th August 2021, India has approved this vaccine for emergency use for those who are more than 18 years. Okay, on 7th August 2021, India has approved as an emergency use of this vaccine for those who are more than 18 years. Thus, for less than 18 years, this vaccine is contraindicated, and also those who are having allergic reaction for any of the components of this vaccine is also contraindicated. And, these all things about emergency use authorization. And we have to know what are the other vaccines are also completed EUA. We got authorization for emergency use in India are Covishield, Covaxin, Sputnik V, Moderna, Johnson & Johnson finally. And even though these vaccines are there, Moderna and Johnson & Johnson vaccines not yet started using among people in India, even though we got emergency use authorization. So these are the 5 vaccines that are completed, that are undergone emergency use authorization vaccines in India: Covishield, Covaxin, Sputnik V, Moderna, Johnson & Johnson. So these are all for today. Thank you for watching. If you like this video, please subscribe and share with your friends. Thank you.